Hi, this is Paul, and we're going to perform a little bit of surgery today. And I just wanted to ask you a few things about your previous dental experiences. What is it that you've gone through in the past, or can you kind of summarize for me what dentistry has been like for you?
Yeah, I come from a family of bad teeth and bad gums, and I don't like dentists. The only dentist who I really like is my present dentist, including, well, two. My new oral surgeon and my present dentist, whom I trust, but I don't like people being in my mouth, and I have a remembrance of it hurting a lot when I was little. I know it's crazy, but I try to avoid dentists to the point of not keeping up with my health care, my oral health care.
Okay. If you wouldn't mind giving me a little more of the details about what is it about the dentistry that you just don't like, other than people being in your mouth and kind of in your close proximity?
You know, it's hard to know. I remember one time one dentist really hurt me. He was doing some kind of a block, and it really hurt. And I think about that whenever you guys get into my mouth.
Okay.
I don't know if it's the loss of control. I've tried to figure it out, you know, and it's like a feeling of afraid of height. You can't put your finger on it, exactly what it is.
Yeah. No, I understand. So it's the experience that's been a little bit uncomfortable.
But there is no doubt that the person who I now go see, I trust him enough that even though I feel anxious, I don't like going to see him, it's okay.
Yeah, okay. As far as this NuCalm, we're going to do this natural way to relax you. What are you anticipating from that experience?
You know, I don't take a lot of medicines until just recently. And so I don't know what it is to take a drug to calm down. So I honestly don't know.
Okay. Well, if I told you that this is drug-free, this technique, okay, it's an all-natural way to relax you. Does that help to relieve the anxiety a little bit, since you're not a drug taker per se?
No, because no. To be honest, I trust you, and therefore I trust what you would give me.
Okay.
And although I probably should know more about natural methods of relaxation, or natural methods of anything, I don't know enough about it to really believe that there's something out there that could work as well as Valium or a chemical. But I'm willing to try it.
Okay, good.
I don't care.
Well, that's all I really need from you today, is just the willingness to try it.
Sure.
And I think you're going to be delightfully surprised. I've had a lot of success with patients with this technique, okay? And afterwards, you'll be relaxed. You'll be lucid. You'll be able to drive and go home, no problem. And the other part of this is that I'm finding is that the actual healing is improving too.
Good.
Yeah, so I'm looking forward to that for you as well.
And I'm looking forward to walking out of here.
Yeah, no, I understand. Okay, so let's go ahead and get started. The process is real simple. Take a couple minutes, and we'll check back with you again when we're all finished, okay?
Thank you very much.
Thank you. Okay, now that we've been through the NuCalm, and we ended up taking 3 teeth out and placing 1 implant, how are you feeling?
Fine.
And
I'm happy that it's done.
Okay, tell me a little bit about it. I know that
it was longer than I thought.
Okay.
And I was wondering why it was taking you so long. I mean,
the procedure itself. Okay.
Yeah.
Tell me a little bit about the experience with the NuCalm. Tell me just candidly what your thoughts are.
It's hard for me to know because I didn't feel anything.
Okay.
But I found myself listening to the music.
Okay.
And therefore, there were periods when listening to the music made me not focus on what you were doing.
Okay.
And that was good. That made the time go faster for me. When I did focus on the music, and didn't think about and worry about what you were finding and whether
Yeah.
I was being a good patient or a bad patient, and that allowed the time to pass.
Okay.
And that occurred much more in the second half of the procedure than the first.
Okay. That makes sense. Tell me a little bit about the ability to joke a little bit, because you made comment there in the middle.
It's funny because I'm not someone who jokes a lot, and I found myself kind of joking with you too.
Yeah.
And I wasn't sure if it was my normal self having a comic relief,
Yeah.
or a little bit of disinhibition,
Yeah.
or lack of, like sometimes. I was wondering whether that was an effect of the medicine. I just wasn't sure, but it was interesting to me that I
Felt
was
that you
joking
could joke. Yeah.
because I don't normally joke.
Yeah. Who would at a dental appointment, especially surgery?
Well,
you
I
know?
mean, some people joke. Some people,
Sure.
their anxiety is exhibited by joking. I don't do that. I get quiet.
Yeah.
So when I found myself doing that, I was wondering maybe that's the effect of the medicine. I don't know.
Yeah, yeah, I think you're right on, because this is exactly what we see. So I think that's good. And I guess the question that I would have, which is always kind of the telltale sign, would you recommend this to someone else?
Absolutely.
Okay,
Absolutely.
okay. Well, excellent. You're an outstanding patient. You need to give yourself a pat on the back,
Well,
okay?
thank you.
It was really a delight working on you today. And I'm looking forward to working with you again in the
Same.
future. And, you'll have a pretty speedy recovery. I'm looking forward also to finding out how you sleep tonight, because I'm confident you're going to have a good night's sleep too. Okay?
I'm sure I will.
All right, we'll see you soon.
Thank you.